for a brief update on the Affordable Care Act, as well as a demonstration of the ACA tracking tool that we have available through the Smart HR Connect system. My name is Jess Erke, and I serve as the Vice President of Client Services here at Smart HR. Many of you might have received the email that I sent out introducing this seminar, and I appreciate your, again, willingness to join us today and to take time to listen in. You will be hearing from a few different speakers who I'll introduce in a few minutes. Before we get started, though, there's just a couple of housekeeping items that I'd like to make you all aware of. If you could mute your phones at this time, that would be great. Sometimes we get some echoing and feedback from different types of systems. So if you could press mute on your phone during this first portion, there will be an opportunity for you to ask questions throughout the session today. So our session will be kind of split up in two parts, where the first part will be an update on the Affordable Care Act, and there'll be an opportunity to ask questions, and then we'll go into a demonstration of the ACA tracking tool, and there'll be another opportunity for you to ask questions. On your screen, there should be a place down at the bottom here that's called chat, and you can write in any questions that you might have during the session that you'd like our speakers to address. I do want to let you know that we're going to keep this within the hour time frame, and we want to get to both sections of the session today. So if we don't get to your questions, there will be an opportunity for you to advance those to one, either your direct service specialist, a consultant that you're working with at Smart HR, or I will also give you our basic general Smart HR service address that you can forward those questions to, and we'll make sure to get you answers. But to use this question field here, you'll want to type in any questions that you have, and then hit the send key here in order to do that. Okay. All right. If we are all on mute, we will get started. So a few of the session goals for today is, first and foremost, to learn some of the need-to-know information that would be applicable to you as an employer, the basics around ACA and how to stay compliant with that to avoid some steep penalties that are to come, whether they apply to you for 2015 or 2016 or yet to be determined. We want to make sure you have the most up-to-date information possible. We'll also show you how to actually gain insight into how to figuring out full-time employees, part-time employees, what a full-time equivalent is, how do I keep track of that, and just some of the basic terminology within ACA, anywhere from what you might have heard floating around measurement periods or stability periods. We will be able to go through some of that to give you a basic definition and understanding of those, a working knowledge. And then I'll also learn how this ACA tool automates and streamlines information from the payroll module, from the time and labor module to the HR module, and combines all those two together. Now I know there's people on the call where you are already part of the Smart HR, you're a partner with Smart HR and are using different components of the system. And we'll show you how some of those, whether you are a payroll-only client or whether you have all three modules, how those different features will work with the ACA tool today. Granted, this is just a general start to this information, and there'll be more to come. The people that you'll be hearing from today include Valerie Folk, who is one of our Smart HR Human Resource Consultants, and also Susan Walsh is one of our Smart HR Human Resource Consultants. You'll hear from both of them around the demonstration, and we're pleased to also have with us today Paul Schultz, who is an ACA certified professional and is housed in one of our partner organizations, OCI, in Omaha, Nebraska, and he's an account executive there as well. So we're pleased to have all three of these talented individuals with us to provide the information today. So with that, I'm going to actually pass it over to Paul to start with our Affordable Care Act update. Paul?
Great. Thanks, Jess. And then just a side note, do I have access to change the slides, or is it, do you want me to just let you know?
Yes, yes. You have presentation control.
Great. Well, good morning, everybody. I wanted to give everybody a brief overview of ACA and some of the terms that are going to be discussed in the overview of Smart HR and how it's going to help you track some of these things. So to get us started, the law was passed back in 2010, and that's actually a picture of the law. It's 2,000 plus pages. The regulations themselves that have come out ever since is a stack of papers from floor to ceiling. So it's an extremely complicated law. There's a lot of pieces in it that make it difficult to get your head wrapped around, and having some different technology pieces to help you with that is certainly a must going forward in this new day and age. And we'll go ahead and move to the next slide. Oh, there we go. First and foremost is, do you need to participate in the ACA in terms of penalties as an employer? Do you have to offer coverage or face a penalty? And so one of the things you want to be on top of is, do you have more than 50 full-time equivalent employees at your business? And it's also important to consider control group rules. So if you happen to, there's common ownership between your company and other companies where you guys would be considered a control group, you do have to add all the employees of those different groups together. So even though your group might be 20 employees, if you're the owner of the company owns several other companies, it's possible you could be 50 plus that way as well. And there is a tool to determine that. This is a screenshot of just a piece of that, that you're essentially putting in all of the full-time employees, those employees working 30 or more hours a week, and then adding in or giving partial credit to the part-timers. And there's a formula to do that. It's a matter of adding up all of the hours the part-timers are working and dividing it out on a monthly basis and adding that number to these full-timers. So that's an important calculation, because then you know if you have to essentially pay or play. And so for 50-plus employers, that piece of it where you need to offer coverage to your employees needs to start in 2016. That was a delay that we saw last year. If you happen to be 100-plus, though, after doing this calculation, you do need to start offering coverage here next year in 2015. And if you choose to not offer coverage, you may be subject to a $2,000 penalty per full-time employee. Now, you can throw out a certain number of employees for next year, and then again in 2016 in terms of paying that penalty. So if you have questions on exactly the details of those penalties, I'd be glad to get you more information, but didn't want to get into too much depth there on that. So let's go ahead and move to, no, actually we can stay here, that's fine. The other piece is, all right, now I'm going to have to offer coverage, or I want to offer coverage to avoid the penalty. There are a couple other things you need to consider. One is your plan meeting minimum value, and your insurance agent can provide you with that information, and that can be stored in Smart HR. And then also, is your plan affordable? And both these things need to be met in order to avoid a $3,000 penalty per employee that possibly this plan wasn't affordable for. And what affordability means is that the employee-only coverage is not costing that particular employee more than 9.5% of their W-2 Box 1 income. And the only exception to this rule is that you have to, for 2015, so these are our 100-plus employers, you need to be providing or offering coverage to 70% of your workforce. So technically, there's 30% of your workforce that you wouldn't have to offer coverage to. Well, if that happens to be the same employees who are the lowest income in your group, so maybe they're minimum wage and your plan isn't meeting affordability for them, you can simply not offer them coverage, which would allow them to go out to the marketplace through healthcare.gov and purchase a plan that way. In which case, if their household income is actually fairly low, they can get subsidies through the federal government on healthcare.gov, and that could be a way to get insurance for those individual employees. In 2016, when it applies to everybody 50 plus, we need to offer coverage to 95% of the workforce. So your group of employees is quite a bit less that can be held outside of this affordability rule. And lastly, it's important for us to, we can go to the next slide, it'll let me. Okay, it's important to track who is actually full-time at your company. For some of you, that may be pretty simple. You know, all of our employees are full-time. However, those with a lot of part-timers or those who have employees who are variable hour, so maybe summer months, they're working 15, 20 hours a week, and we get into the holiday season, and all of a sudden it's 50 or 60 hours, and you're saying, well, do I need to offer coverage to them just during the holiday season, or is it year-round, or how do I track that? That was very detailed out in the regulations, and that's where these measurement periods come into play. So the idea is that you're going to have an ongoing standard measurement period that's really tracking those hours of those employees that you haven't defined as full-time, and it's tracking them over most likely a 12-month period of time. There is some variation depending on the type of business that you do as far as what makes the most sense to track. But you're essentially looking at it over a 12-month period of time, and during that 12 months, if they're averaging more than 30 hours a week, they would be considered full-time in terms of the ACA. And so that may be a case where you do want to pay attention to those employees, because if now they're full-time, you have to offer them coverage. So if your intent is those employees were hired as part-time and you didn't want to offer them coverage, it is very important to stay on top of how many hours those employees are averaging. If they are determined to be full-time, you have an administration period where you can enroll them onto your current benefits, and then they are on the benefits for 12 months if they choose to enroll. And so that would be the stability period. And then they will be constantly monitored then from there on out in a measurement period. Now, because these measurement periods, and we can go to the next slide, are set for your company on an ongoing basis, you have to take into account new hires. And so a new hire would go through their own initial measurement period, and that would most likely also be 12 months. And so that employee would have their own initial measurement period where you're watching to see their hours, and then they would have their own administration stability period. But once they've been there for that year, they now fall into the rest of your current workforce and undergo the same tracking with the standard measurement periods and stability periods thereafter. So again, could be a lot of different measurement periods going on. They tend to overlap each other because you have new hires all the time. So that can be pretty difficult to track outside of any sort of tool. This would be difficult to do on paper, if you will. The other thing to keep in mind is the fact that we may see more delays. This is a very complicated law, and especially for employers trying to figure this out with their workforce. And what we saw last year was it was too complicated, and they had to delay it for another year, 2 years if you were 50 to 99. What we saw, I was in Washington this spring. Basically, they're in gridlock, and that no votes for changing anything with the ACA was going to come to the floor this summer until we get past the election. So there could very possibly be a delay on this. Again, as far as employers are concerned, we won't know until after the elections. But mind. If you get too overwhelmed with all of this, that who knows, maybe it doesn't apply again for another 2 years. But with that, I will turn it over to our HR gals to go through the demonstration. Unless there's any questions. Yep.
Before Sue and Val jump on, I do want to pause and see if there is any questions from the people that have joined on the call in regards to what anything that you came in questioning regarding the Affordable Care Act. I will couch, as Paul stated, that the ACA continues to change, and so if we don't readily have the answer today, we will make note and make sure to dig into it and get information back to you, whatever may be available. But if you do have some questions around the Affordable Care Act and your business right now, this would be the opportunity to ask some of those questions. Okay. If, again, they might come up as we continue to go through the second part of the demonstration of the tool. And if they do, or if you get some later on, I'll make sure to give you the contact information and you can have those answered directly. Okay. Or, yes, please type them in as we go. Okay, so with that, I will turn it over to Sue. And go ahead and you can start the demonstration of the ACA tracking tool.
Okay, good morning everyone, and thank you Jess and Paul. What I'm going to do is I'm going to show you how the data is utilized within the system and demonstrate some of the reporting features of SmartHR's ACA module and how it will tie into some of the information that Paul just covered. Okay, here we go. The first thing I'm going to do is I'm going to take you to the Employee ACA report. How you get there is you click on My Report, ACA, and then Employee ACA. And you will see in this company that all the employees are listed. I have a little box here that I need to get rid of. There we go, thank you. What you're going to want to look at is the employee's ACA history, and you can do so by clicking on this icon here. And I'm actually going to close this out, and I'm going to come back to it and go into further detail. First of all, I wanted to talk about some of the other features that are on this, this particular report right here. If you go down to the navigation bar, you have an Import Historic Data link. This allows you to import historical data from an Excel spreadsheet that has not been tracked in the system. So let's say that you have added some historical information into the report, then you will need to recalculate, which is this button here, and you can specify the time frame that you want to recalculate. It'll calculate all of your employees. Returning back to the ACA history, as I said, you can click on it with this icon here, or you can actually attach it right to the employee's profile. To get to the employee's profile, you're going to click on this little blue person here, and you'll see that we're going to click on Jennifer Aniston. It'll go right to her profile. Scroll down. And there again, whoops, a little delay, it goes a little further. And there again, you can see the ACA timeline that I showed you a few minutes ago. Okay, trying to get it centered here. All right. So let's take a closer look at the data that's within this tool, and it'll also tie into the information that Paul went through with some of these measurement periods. On the first row, again, this is for Jennifer Aniston's record. You can take a look at, in the last 6 months, the number of hours she has worked per month. The status is whether she is full-time or part-time based on those number of hours per month. If she is over 130 hours per month, then she is considered full-time. And then likewise, if under, then she's part-time. Now the ACA status, this is the actual full-time and part-time ACA status after the employee has reached the end of their measurement period. It averages the number of hours worked during that period and automatically change the status from full-time to part-time based on those results. Sorry, scroll down here. We have the initial measurement month, and as Paul pointed out, this is for the new hires when their time starts. And the administrative period, again, this is when the employees are transitioning into benefits eligibility. And there is a 90-day open enrollment period for which you will notify the employees of their eligibility and they may enroll. Measurement month, as Paul said, is the reference period that you will use to gauge employees' benefits eligibility. This will show you within the stability month which month they are in. Paul mentioned the stability month after they have become eligible and are on their benefits is for 12 weeks. So you can go through and see which month they are in within the stability period in this row. Now, if you are tracking benefits in the system, you also have the capability to see if an affordable plan and also a minimum value plan is being offered. If you are not tracking benefits in the system, then these two will not appear. And then we have some final alerts. If there are any compliance alerts, this will let you know that you can check into. And then also for each employee, you can see if they are approaching full-time ACA status or if they are full-time but they have a possible downgrade to part-time. And this report can be run by any date range, you know, whether it's 3 months or 12 months. And you can change the dates in here, and you can easily even just scroll dates, you know, months ahead or backwards by hitting these buttons. And then you have a calculated to date that indicates where the hours are to be calculated to so far. All right, we're going to go back to the previous screen, and we're going to take a look at the ACA Data Detail Report, which is down here in the navigation bar. You will notice that this is actually the same information that was on the ACA history, except that now that the information has become columns. And the reason why is now you have the flexibility to use this data to create reports, you know, for certain criteria, such as, you know, who is or is not in compliance, or who may be approaching a status of full-time or part-time. So, for example, right here you can see approaching ACA full-time. It'll list by employee if they are. And you can also sort this by various date ranges. As you can see, there are quite a few. So I'm going to click on last quarter, and you'll see where it'll add information for information within the last quarter. Also, for ease in looking at this information, you can also group the data. So let's say we want to group it by employee. Whoops. You will go to the G, Group by Employee icon. And there you have it. I am once again going to return to the main screen where we're going to take a look at the ACA Data Summary Report, which is, you can click on down here. And again, this is all the same data we've been looking at, except for it's in a global perspective. If you want to see just totals of all of the employees' number of hours, how many people are, you know, part-time, and you can click on any of these hyperlinks to see the data within. So again, I'm going to use the approaching ACA full-time status. As an example, we'll click on the 7. And it'll tell you who those 7 people are right on the report. Now, the nice thing about this report is that it can be added to your dashboard, so that when you log on, you can see it right away, and it's readily available. So to get to the dashboard, you're going to click on the Smart HR Connect icon, and there you have it, right there. So you'll certainly want to keep tabs on who's approaching full-time status or who is close to a possible downgrade, so that you can manage your employees more effectively. These reports will help you stay in compliance with ACA guidelines and be proactive in managing your ACA strategy. Now, to further demonstrate the flexibility of the reporting function, Valerie Folk is now going to show you a couple of examples of how you can drill down this data by customizing your report.
Thank you, Sue.
Yes.
As Sue mentioned, there's a lot of flexibility in the reports within the system. I'm going to go back to her detailed report. She went to My Reports, ACA, and ACA Data Detail. And this report is showing you a lot of different columns. Let's say we want to make it a little bit more usable for certain features that we want to look at, like maybe who is just part-time. Maybe we don't need all these columns. You have this great little toolbox button up on your reports. You just click into it, and then you have the ability to select columns. And from here you can add and remove columns by clicking on the little arrows next to the particular item you're looking at. So we already have the employee's first and last name in here. I don't think I want the username or the employee ID, so I'm just going to remove them by clicking on the arrow from the report. I also want to see who is considered a full-time employee or part-time employee, how we classify them. So I could either scroll through this list of all the different items you can add to your report, or you can actually search for items on the top search bar. So I'm going to add employee type. You click on the select column magnifying glass, and it readjusted my report, took out a couple additional columns, and added in this employee type. Now, a lot of times when you're tracking something for ACA, it's really those variable hour employees. Are they coming up on full-time status? Your full-time employees, such as this Kathy Watts, who's full-time exempt, you know that they are already full-time. You don't need to track their hours. So I don't want to see them at all in my report. So all the different columns have drop-downs that you can sort by. So I'm going to pick this little one that says I do not want to see something. So I do not want to see full-time exempt employees. So putting that in, it got rid of those additional employees. Now I have a report that is just showing my people who I have variable hours for so that I can watch those hours a little more closely. Now if this is a report you want to see all the time, you don't want to go through all these steps, another great tool is that you can save these reports as your own reports that you can view whenever you need them. If you go to the Save settings, you can give it a name so you remember what it is. You can make this your default report, or you can have it run immediately every time you click on it. So I'm going to hit Save. And now if you go up to this little view box, I can either go back to my default report, which is the one that you initially came into that will always be available to you, or I can go to the report I saved, and now I don't have to keep recreating it. So another great feature if you are using all three modules in the system is that once an employee is in that period where they're now eligible for benefits, they can easily access their open enrollment information. So I'm going to pretend Kathy Watts here has now hit that time period where she can enroll in benefits. She goes to My Account, My Benefits. She can click on Review and select Benefits. From here, there's a lot of different features. She'd be able to see what she's currently enrolled in if that was applicable. But right from this screen, she'll be able to either start open enrollment, and that would be configured based on everybody's particular configuration, what their open enrollment periods are, or they can do a life change event at any time. So she'd be going into here, and this could all be set up for each individual's needs, instructions, what different type of plans you have. They could select them, confirm them, go to someone to approve them, and then you can also get reports and notifications when people do that. Okay, so that was a little bit more about the system. As you can see, there's a lot of different things you need to know about, a lot of information to track with the ACA. So how can SmartHR help you with this? So we have the technical side, we have the system, the different reports that you've seen, and an all-in-one encompassing record. So So it's one interface, one database. You can store HR, payroll, time and labor. And then you also have access to HR consultants, such as myself and Sue, and ACA professionals. As I said, it does integrate HR, payroll, and time and labor into one system. You know, the module itself is going to be best used if you pull in all three. And it's going to look different depending on which modules you are actually using. For example, it's not going to be able to show you if someone has an affordable plan if you don't have the plans actually set up in the HR module. Time and labor is going to track hours worked, so their full-time and part-time status, and help you manage those look-back periods. HR is again going to help you enroll in benefits when employees hit that full-time status and track the minimum value. And then once they actually are enrolled in those plans, compensation actually pulls from the payroll side of it to ensure that the plan is affordable. Again, a great benefit of the system is just one employee record. So Sue did walk you through some of the great tools that the ACA module helps you with. You have access to both the current and historical data for various ACA status measurements, such as those stability periods. There's customizable management dashboards for easy access to the ACA data, and you're able to drill down and view each of your employees. You can view employees' current status or historical status by month with that ACA timeline views. And there's a lot of different notifications that can also be set up to help the managers. If there's a possible upgrade or downgrade, email notifications can be set up. If an employee is approaching benefits eligibility, there's notifications. Or if employees have scheduled hours that would put them over eligibility limits. There's also notifications that we can send to employees to help them automate that enrollment process like we showed. The module you saw today was incorporating all three, HR, payroll, and time and labor. Again, it's going to look a little different depending on what you are using. The data will also be best used when you have data encompassing a full look-back period. So is there any additional questions now that you're able to actually see the tool and hear a little bit more about the features that it can offer?
Thanks, Val and Sue. I do want to thank you both, and Paul. I know that there was one question that came in regards to what is the ability to have access to some of the information that is shared. And we will make this has been recorded, so we can make that available. And then to the PowerPoint and some of the resources shared, you know, Paul shared a great resource in regards to calculating FTEs. And that is something we can share along. That's an additional tool that works great with the ACA tracking tool. And so we can make that available to our partners at Smart HR as well. So that was one question that did come in. So yes, we will make that available to you directly. Are there any other questions today? If you do have some specific business questions, there's 3 different ways that you can get in touch with us. One, this is our general line, and we will direct the questions as appropriate. If you are currently a partner with Smart HR, we'll make sure to get you in touch with your service specialist here at Smart HR, and then they will escalate your questions and find you the appropriate answers. If you're actually somebody who's just joined us to learn a little bit more about Smart HR and how we can support you and all of your HR needs, you can speak to one of our business consultants. Andrew or Josh would be happy to speak more with you and also access any answers that you might need in regards to that. And again, our general number is always available. So with that, we want to thank you again for joining the call today. We will follow up with a brief resources that were shared today, and then also a brief survey for you to fill out. Again, we're here to help you manage your workforce from recruitment to retirement, and we're pleased that you have chosen to partner with Smart HR and have considered joining part of our family here. So thank you and have a great afternoon.